So whether we like it or not, we are always being monitored by this digital eye, the digital ear, and it keeps track of us. Even now, I'm staying several kilometers away, and you are all being monitored. Can all of you raise your hands, whoever has used artificial intelligence in your life? Anyone who has used AI, artificial intelligence in your life? Okay, so it makes my job easier because this is going to transform your life, this 10 minutes, because after I started using artificial intelligence, I have become Guhan version 2.0. And to introduce myself, I am Guhan. I'm a neurologist trained in neurorehabilitation. And I place this talk as an ode to, as a tribute to the Dr. John J. Hopfield and Dr. Jeffrey, who have placed the basics for the artificial neural network and for which they were awarded the Nobel Prize in Physics this year. And it is a wonderful transformation. So, what is all this artificial intelligence about? It is the science and the engineering of making machines think. So this is where the doctors are wedding the engineers. So it has become an integral part of our life. It has been there for several years, but not so strong enough, but it was a little weak so far. So what is this artificial intelligence? Say, for example, if I were to make a machine that could transform automatically a hot water to cold or a hot water to cold, uh, or a cold water to hot, then I need to hire a software engineer and write a program. And this program for just hot to cold and cold to hot is going to run for several pages together. But what if I were to make the machine think? Then it would become much easier for me to do all the programming. Just give the computer the instruction, the computer is going to do all the thinking and the programming. So that's the art, science, and engineering of training the machines to think. And that's all artificial intelligence is about. So, akin to a human brain, this artificial intelligence is an artificial neural network, very much similar, and this is the artificial neural network, very much similar to our human brain. So, the first part of this talk, like the neuroanatomy, we are going to focus on the organization and neuroanatomy of the artificial intelligence. In the second part, we are going to focus on the functioning and the evidence. So, artificial intelligence includes machine learning. And one subset of machine learning is deep learning. And there are various methods through which deep learning happens. The one that's commonly used now is the artificial neural network that we just saw. So let me tell you what is artificial neural network all about. Before that, machine learning has three types. One is supervised learning, unsupervised learning, and reinforcement learning. Supervised learning is when I give the computer a data set and give the answers to it as well. The computer learns from it, the question and the answer, and then I can conduct a test for it. Whereas unsupervised learning is that I give just the data set and the computer interprets it based on clustering. And further feeding the data further and further, the computer learns more and more. And reinforcement learning is when I correct the computer whenever it's wrong, that reinforces its learning. And these are the three types of machine learnings. So it's all started with neuroimaging a tumor. When you feed in the imaging data, and the artificial neural network is able to categorize it into an oligodendroglioma or an astrocytoma. This is based on the water content, the fat content, the tissue content, and everything that is being analyzed by the artificial intelligence. And this has gone a long way in neuroradiology conferences now. And it's not just categorizing apples and tomatoes, it's much more than that. It's like you have an input layer wherein it takes all the necessary data, the fat content, the water content, the tissue content, everything. And these are the hidden layers, and finally gives the output. Is it an astrocytoma or is it an oligodendroglioma? So these hidden layers are like each hidden layer is given inputs, is given weights. And based on the weight, the final calculation happens. The easier way of describing is in our OP, when we see patients, what an outsider sees is that the patient complains of a left arm pain, but the doctor is prescribing medicines in the next 2 minutes or so, and makes the diagnosis and initiates the treatment. But what is not seen by this outsider is years of academic knowledge, years of several thousand patient years exposure, dedicated skill development, heuristics, pattern recognition and empiricality. And this is what is not seen, and these are the hidden layers for the doctor's brain. And similarly, for the artificial intelligence, there are several hidden layers that just gives the output for a given input within seconds. And the Turing test, every AI has to pass this Turing test. Like if I'm on the other side of the wall and there is a computer and the human on the other side of the wall away from me, if I'm unable to make the difference between the computer and the human, then the artificial intelligence has passed the Turing test. And the types of artificial intelligence are weak AI and strong AI. Weak AI is your Siri, the chessboards, and these are weak artificial intelligence because they are limited by commands, and anything beyond the routine command, they don't respond to it. Whereas a strong AI has the ability to evolve and continue to learn new undefined tasks. And they're able to interact with the environment, respond accordingly like a human intelligence would. But so far, we have not incorporated emotions into them. So say for example, this is the artificial intelligence robo. These are the inputs, vision, there is whatever input it can take, it processes and finally gives the output. And this is all artificial intelligence is about. And now coming to the artificial intelligence, the functioning in the SCI, spinal cord injury, main role lies in the gait rehabilitation. For example, it lays its hands on every aspect of rehabilitation. The artificial intelligence is dependent on numbers. So gait, when you have numbers, velocity, cadence, step length, stride length, everything together, you numerize the gait and you use sensors to find out the gait metrics. And once you find out the gait metrics, then you can use artificial intelligence for gait activity detection, gait event detection, gait disorder detection, gait asymmetry detection, and neurological studies in gait. And say, for example, you have this robot which is able to sense all the parameters of the gait. Now, if I add an artificial intelligence to it, based on the sensor input into the artificial intelligence is able to tell the reply to the patient's gait pattern as either great, pull up your trunk, or tilt your trunk to the left, tilt your trunk to the right, relax your left leg and follow the robo, and relax your right leg and follow the robo. So it's actually able to give you feedback as to how you perform. And this makes the job of a therapist much easier, and they can attend to multiple patients at the same time where artificial intelligence is starting to help them. And in this paper, it was shown that based on this the input feedback, the artificial intelligence was able to guide the patients in rehabilitating them. And 11 out of 12 times, the instructions were similar to that of the human therapist. Next, coming to the brain-computer interface, it's where you put in a chip on the brain, create an interface. This chip analyzes the brain activity and decodes it, and this activity, once inside the computer, can be used to modulate several activities that we would require for improving the functioning of the patient. And EEG, fMRI, and NIRS are used to acquire the signals, and these are the various signals that are interpreted from the brain. EEG interprets these signals, fMRI, the blood oxygenation levels, and NIRS is the cerebral oxygenation changes. And based on the signals that are acquired, it can be used for communication, because once the implant gets the information out, it's able to communicate through a computer or a voice-assisted device. Or it can be used for assistive devices in controlling your wheelchair, or it can be useful in controlling a bionic arm. And it can also be used for rehabilitative purposes. And these slides look like as if they are from a fantasy world, but let me tell you, it's currently in human trials. And Magneto, we all have seen while we grew, we saw Magneto, the X-Men, controlling everything with his mind, and that's using the brain-computer interface. And here is this Neuralink device by Tesla, and I have no connections with Tesla, but I was just fascinated by their trials. And this Neuralink is able to get the brain signals and decode it to control a cursor on the computer screen. I thought this would really be slow. So I took the same test that this Neuralink patient had taken. And my score in controlling the cursor was 8.5 BPS. that's the score that I get for controlling the cursor. And I'm a person who have been using computer from the age of 10, and my score is 8.5. That's close to a 25 years, and my speed is 8.5 with the mouse. Whereas the patient who has a Neuralink, who is quadriplegic and can control with his mind the cursor, is able to generate a score of 9.5 BPS. I tried beating this score several times, and I'm unable to beat it. So literally, we are looking at superhuman powers in the future and not just rehabilitating patients. And there was a setback that these threads started to retract the implants, and now they have addressed it, and the second human volunteer is now uh, starting the human trials again. And
Sir,
we are marching towards artificial general intelligence, where,
10 minutes are over.
yes, sir, I'm
Please
last
conclude.
minute,
Yeah,
sir.
thank you.
And here is one artificial intelligence. I am asking the question. Hi, I have a 54-year-old male who suffered a spinal cord injury with Asia B and D6 level. What are the rehabilitation options I can provide to my patient? And it just gives me the whole rehab program that I can follow for this patient. This cannot replace the analysis by a neurologist or a therapist or a neurosurgeon, but it definitely helps us so that we don't miss anything for that particular patient. You can see everything is included in that. This is one on the left. One on the right, if I specifically need to address this dorsiflexion strength in lower limb, what electrical stimulation for protocol can I follow? And it also provides the electrical stimulation parameters. And I was really skeptical about it, more inquisitive. And I asked it, you are providing me all the pulse duration, frequency, intensity, duty cycle, and what is the reference for that? And the artificial intelligence was able to provide the reference for this protocol from all the internet sources where it had taken it from. So it is a scientific evidence based protocol is being provided. Only thing is that we need to be wary about it, and we need to probe more into it, and it can really transform our lives. And here is one other thing, the assistive device. Designing an assistive device, you ask the engineer,
Sorry,
he
sir,
would
we are
tell you
running
how
out of time.
difficult it is.
We are running out of time. Sorry. Please conclude.
Hello?
Yes, please conclude. We are running out of time.
Sir, voice is heard, sir? So the computer can actually generate the assistive device. So, and we can use it for 3D printing, and this is for holding a fork. And welcome to the world of AI. These slides are created by artificial intelligence, and only these slides. So it can also help you create PPT for the neurologists, neurosurgeons, and therapists. Only thing is that we are yet to incorporate consciousness into it and emotion into it. AI lacks consciousness. What happens if we incorporate consciousness? Would we have a superhuman species that would be hard to handle? Is it going to be destructive? The future holds the story. Thank you.